just talk first about the primary school curriculum. So the primary school curriculum is divided into 7 areas. They're all listed there, and I highlighted the 2 areas that are most relevant to the area of health and well-being. Obviously the physical education, and then we have another subject which is the social, personal and health education. And just a little bit about that subject. It is a subject that is packed with topics. We're under pressure constantly to add new topics to this, but really this subject it fosters children's well-being and their self-confidence, and it gives them a sense of belonging, and it helps them to be informed citizens. So it's a curriculum that runs from junior infants right up to 6th class, and there are 2 main strands in it: myself and others, and myself and the wider world. And I just picked out a few of the issues that are covered in that, which are relevant to the health and well-being agenda. It talks about food, it talks about keeping healthy, good hygiene. Then when it moves on, so that's about the individual. Then it teaches children about family structures, about different cultures. So here we're talking about not just children's physical well-being, but it helps inform, it helps their mental well-being, helps them understand where they fit in. Then also myself and the wider world, and this gives them a picture of the wider world, about care for the environment, about poverty, about citizenship. So all this I think is very key in terms of education around health and well-being. Physical activity in primary school, the PE curriculum at primary school, it's 1 hour per week, and there are 6 strands within the physical education curriculum: athletics, dance, gymnastics, games, outdoor and adventure activities, aquatics. Now, unfortunately, not all our schools would have access to a swimming pool, so that wouldn't happen in every case. Then, if we move on to post-primary, some of the previous speakers touched on the junior cycle and what's happened there. This is very, very significant for us. Just to give you a little bit of context about the junior cycle, it was a significant reform of post-primary education. That's the first 3 years in post-primary education. So it was a different way of thinking, and it was a way, so the junior cycle framework, which was published in 2015, it recognises that there's a need to recognise a wide range of learning for students. It reduces the focus on the one terminal exam, and if you're watching the media today is the first day of the state exams, and there's this huge focus on it and wishing everyone luck and all this focus on the point system. So really, it's huge pressure for students. So the junior cycle framework is trying to move a little bit away from that. And in doing that, it is increasing the focus on classroom-based assessment. So it's not all about the terminal exam, it's about the assessment throughout the 3 years of junior cycle. And also for the first time, parents and guardians and students, they get a much broader picture of students learning. Now at the end of junior cycle, as well as receiving the results from the state exams, you receive results from the classroom-based assessments, and you also it also includes text around other areas of learning for the students. And also then there's this new area of learning called well-being. So it's not a subject as such, it's an area of learning. So I think all of the changes in junior cycle are relevant to the health and well-being of students. And I'll just talk a little bit more about the junior cycle well-being programme. So as I said, this is the first time we've had this acknowledged officially, but we all know schools have been working towards the well-being of their students. So this just recognises the school's commitment. And there should be there are 4 aspects to the well-being programme in schools. Well-being programme in a school, it needs to take account of the school culture. It obviously has the curriculum part to it, which is there are some core curriculum pieces within the well-being programme. That's the physical activity, the social, personal health education, and also the civic, social, political education programme. Relationships then within the school, and that's peer-to-peer relationships, that's the teacher-student relationship. All this is students' wellbeing in school. It's all tied into the culture of the school, and also then that's linked to the last point there, the policy and planning. Schools must have, their anti-bullying policies in place. They should have their healthy eating policies in place, internet safety, critical incident policies. So when a school is looking at a junior cycle wellbeing programme, it needs to take all of these factors into account. Then at senior cycle, and this was touched on I'll deal with SPHE first. Currently SPHE is optional at senior cycle, and that is seen as a gap by many. Now, one part of the SPHE curriculum is the relationship and sexuality education programme, and that part is core at senior cycle. Then it was touched on earlier by speakers, and these are a very significant for us really, and these are the changes to the physical education programme in senior cycle. For the first time there will be an exam subject in physical education, and this will, I think, increase the number of students interested in this physical education. Also then, of course, not everyone will want to study physical education as their exam subject, so there is also a new framework for physical education. And this provides schools with a framework, and within that they can design their own programme, and they can design a programme that suits their school, suits their needs. So in September 2018, the first schools will commence the framework and also the physical education exam subject. So 2020 will be the first time that we'll have the exam in physical education. And I think it's a very key theme today. The word partnership, collaboration is coming up, so I'm going to add to that. If you only use the words that we can't do it on our own in health, we can't do it on our own in education. So we work closely with the Department of Health, with the HSE, with the Department of Children. In terms of working with the Department of Health, we've worked with them on the National Physical Activity Plan, the Healthy Way for Ireland strategy, the National Drug Strategy. I don't have all the strategies there's so many, but we've also worked with them on other issues. The Department of Education issued healthy lifestyle guidance to schools, and we worked with the Department of Health on this, and this was a circular letter to schools. We like to think when the department issues circular letters that schools follow it to the letter, but it set out very clearly where we stood on a number of issues around PE, that the PE requirements must be upheld, that and we do have an issue. We're aware, we find some schools, post-primary schools, when it comes to the exam years, the state exams, they pull back from PE.